There are two types of genetic testing, and they get confused a lot, so it's kind of good to talk about that. One is genetic testing that are done before embryo creations. And nowadays we test for 200, 300, 400, 500 mutations. And we want to detect any type of genetic diseases that could be potentially harmful to the baby or cause a disease. Now, the majority of those conditions, both egg and sperm provider need to be positive for the baby to be affected. But nowadays, as we check more, we see that sometimes it's enough to have one condition that will pass to the baby. So genetic testing is the first layer of kind of, safety. And absolutely any couple trying to conceive, regardless if they come to us or not, should do genetic testing. And in the past, we used to see families with a lot of cancer and didn't know what to do about it. And I'm like, oh, you're at increased risk. Nowadays, we can do cancer screening, not only for breast, but for other like GI and pancreas. Any genetic mutation that we find that could be harmful can be prevented to move on to the next generation. So that comes like, maybe you don't want it for yourself, but you definitely want to know it for your children. So very important. So that's the first layer. The second is genetic testing on embryos, and that's like the PGT or PGTA nowadays, PGTM. PGT, it's testing all chromosomes on the embryos and detect things like Down syndrome or other chromosome issues that are some of the main cause of miscarriages, mental retardation, malformation. We also get to know the gender, but that's just a plus. So the way the PGTA is done is throughout the IVF cycle. The first part is, of course, the woman or egg donor goes through the stimulation. It takes about 2 weeks to retrieve the eggs, fertilize them. The embryos grows in the IVF lab until they reach a stage called blastocyst. Those are embryos that have 200, 300 cells. And at that point, the embryologist very gently with laser actually make a tiny, tiny opening in the outside shell of the embryo and aspirate about 5 to 6 cells. The embryo gets frozen and those cells get sent for the genetic testing. And genetic testing nowadays is so advanced that they can detect very small changes in the DNA material that in the past would have caused miscarriage or other issues. So at the end of this process, we get the result for each embryo, boy or girl. Is it a normal embryo? And if it's abnormal, what's the abnormality? So a huge advantage of it is to allow us to choose a healthy embryo to transfer back and increase our success rate. When it comes to genetic conditions, of course, things like, any type of severe genetic disease like cystic fibrosis, or some that were, spinal muscular atrophy and others, you can prevent them altogether.